Since 1897, WHS Washington Hospital has consistently provided top-tier care to patients in southwestern Pennsylvania. The hospital's critical care unit houses 27 adult acute care beds, serving a wide spectrum of patients from those requiring long-term ventilator support to those undergoing complex cardiac bypass surgeries or dealing with challenging conditions such as ARDS. During the COVID-19 pandemic, the hospital upgraded its ventilator fleet to Hamilton Medical ventilators.
So we were looking for a ventilator that had what we needed. We didn't want to overpay for ventilator technology that might not ever be used. And the Hamilton, the variety of platforms allowed us to tailor our purchase to what the organization needed, which is why we have some high-end C6s to some workhorse ventilators, the C3s, and the T1 and the MR1 was a huge improvement in our ability to safely transport patients to MRI. During COVID, during high census, we also used the MR1 and the T1 as ventilators. So rather than tying up a C6 or maybe a post-open heart, we were able to put them on the T1 and do exactly the same things without any decrease in quality. And the fact that the software is really the same between the platforms made it much easier for us to go from one to the other.
It's basically, if we transport a patient and having the T1, you just go right from this ventilator to that. There's not a whole lot of changing settings or anything. It's the same ventilator, just transportable.
The fact that the software all flowed in a very similar fashion was, you weren't learning 4 different ventilators, was a huge advantage. And again, by tailoring our purchase to what we needed, we were able to save capital budget monies. So when we started using the ventilator, one of the things that myself and as a department, had to get used to, which was a nice surprise to me anyways, was how much clinical information that we could get as we're looking at how you set up the machine, optimal comfort and effectiveness on the patient.
I feel like our ventilation practice here has improved with the Hamiltons. We have more options, better ways to ventilate the patient, better ways to see how we're ventilating the patient.
It made what we were already doing that much better because we had more information in our hands and there's things that we could see and there's things that we could do and everybody was happy.